For the past few years, public health leaders here in Maine have been tracking a drug called Xylazine.
On the street, though, it's known as tranq because it's often used as a non-opioid animal sedative. Well, now it's commonly being seen in Maine's illicit drug supply. News Center Maine's Caroline LaCour spoke with public health experts as they monitor the issue and has more on how this might complicate the state's work to reverse the gains Maine has made in the opioid crisis. Caroline?
Brian and Amanda, the numbers from the Maine Drug Data Hub show that 30 people died this year alone of an overdose involving fentanyl mixed with xylazine. That number makes up 17% of all confirmed overdoses as of May of this year, and a 10% spike compared to last year.
So we work with individuals who have an active substance use disorder to make sure they're connected with care and services.
Carrie Barton works on the harm reduction services team at Portland Public Health. Her job is to make sure everyone has the tools they need to reverse an overdose or, if possible, prevent one from happening in the first place. But that's getting tougher to do because Barton often doesn't know what she's up against.
The drug supply is very unsafe and has been for several years. So most of the time, folks don't know what they're taking.
For the past couple of years, Xylazine, also referred to as tranq, has crept into Maine's drug supply. Rick Desjardins is the director for the Maine Drug Enforcement Agency.
And you can't determine it based on its look or smell or anything. That people do not know what they're consuming in many cases.
Desjardins says the substance is frequently being found in Maine as an additive, combined with other illicit drugs such as heroin or fentanyl. While the state of Maine has made great strides in distributing naloxone to be used in the case of an opioid overdose, if mixed with xylazine,
it does not affect xylazine, which is, again, a really massive problem. And again, could be a huge contributor to an individual suffering an overdose.
We certainly are well aware of that. And we work with the public safety people who are seizing a great deal of drugs coming into the state.
Director of Opioid Response Gordon Smith says right now a $1 million investment has been made to educate Mainers on the dangers of the drug and for prevention tools like these test kits.
Honestly, the person will find out within, just 30 seconds.
Or kits to prevent wounds, a major side effect of the drug. Barton says there are concerns regarding other drugs circulating in Maine right now, but xylazine is definitely on the front burner.
So this is what we are more worried about with individuals who are using a substance and don't realize xylazine is in what they're taking.
Now, Smith also points out that from January to June of this year, Maine saw a 12% drop in overall confirmed and suspected fatal overdoses when compared to the same period last year. Brian, Amanda?
Caroline LaCour, thanks to you.